What happens if plastic surgery complications arise? Imagine going through a procedure and suddenly facing unexpected issues. That's why understanding what happens if complications occur is so important. When complications happen after plastic surgery, the response depends on how serious they are. Some issues are minor and can be managed with simple treatments, while others might need urgent surgical intervention. Common complications include infections, wound reopening, blood collections called hematomas, problems with implants, nerve damage, or even life-threatening events like blood clots or sepsis. Most minor issues can be treated conservatively. For example, a small infection might be managed with oral antibiotics, and minor fluid collections called seromas can often be drained easily at the bedside. However, more serious problems requiring prompt medical attention. For instance, if there is a large hematoma, it may need to be evacuated surgically under anesthesia. Infections that do not respond to antibiotics might require surgical cleaning or removal of infected tissue. If an implant is involved and becomes damaged or hardens due to scar tissue, known as capsular contracture, surgery might be necessary to replace or remove it. Life-threatening complications such as severe infections, deep vein thrombosis, which is a blood clot in a deep vein, or pulmonary embolism, where a clot travels to the lungs, need immediate intensive care. Anesthesia-related issues, although rare, can also be serious and are carefully monitored during surgery to prevent allergic reactions or respiratory problems. Infections are among the most common and serious complications, especially with procedures involving implants like breast augmentation. They can range from superficial skin infections to deep infections that threaten the implant and overall health. Early detection is key. Symptoms like redness, swelling, pain, or fever should prompt quick medical evaluation. Treatment often involves antibiotics guided by cultures, and sometimes surgical cleaning or removal of infected tissue. Wound issues such as dehiscence, where the wound reopens, need quick attention to prevent further tissue damage. This might involve cleaning the wound, antibiotics, and resuturing. Patients are advised to avoid strenuous activity during healing to reduce this risk. Implant-related problems like rupture or hardening can develop months or even years after surgery. Regular follow-up appointments help catch these issues early. Patients should be aware of warning signs like unusual pain, swelling, or changes in the shape of the area. Anesthesia complications are rare but can include allergic reactions or breathing problems. That's why anesthesia is always carefully monitored by trained professionals. If any complication occurs, it's crucial to seek help from your plastic surgeon or go to an emergency facility. Larger medical centers are better equipped to handle complex or emergency situations. Overall, managing complications involves a team approach focused on early recognition and appropriate treatment. Following your surgeon's postoperative instructions and attending follow-up visits are essential steps to minimize risks. Remember, every patient is different, and complications can vary based on individual health and the type of surgery. Always discuss potential risks thoroughly with your healthcare provider before surgery, and seek prompt medical care if any issues arise afterward.